In this video, we're going to demonstrate how to use our horse or cow jugular vein models. So these are not quite as fancy, but we have the advantage of having several of them and they're easy to reuse. So we're going to talk about jugular venipuncture, jugular injections, and we can practice jugular vein catheterizations and butterfly catheters. To do a blood draw on a horse, they do have fairly low blood pressure, so it is helpful to hold off. I see a lot of students holding off the jugular vein down low and trying to stick the vein up high, and again that just takes more time. So you might as well hold off close to where you're going to inject, and you should be able to get a fluid wave. So if you kind of pass along or pat along the length of the jugular vein, you can feel fluid underneath your thumb. Get an idea of where the jugular vein is. The longer you hold off, the more it's going to stand up for you and it'll be easier to hit the jugular vein. Once you identify the jugular vein, then again bevel up, start pouring the needle in. You can see I didn't know how to use my scissors. And you can pull back and get your sample. Release, hold off the vein, and you're good. When we're doing a jugular vein injection on a horse, it is often very important to make sure we're in the vein, not in the carotid. And when a student is doing it, as clinicians, we like to make you use a very large needle and keep the syringe off the needle until you get your blood back. When you use a large needle, if you're in the vein, you will get drops. If you're in the artery, it will be more of a spurt. So we like to see the blood dripping, and now we know that you're in the right spot. You can let go of the needle, attach your syringe with the compound you want to inject, hold off again, double check that you're still in the vein, and then you can release and inject. For jugular vein placement or jugular vein catheter placement in a horse, very similar to injection, except we will head downhill or downstream. So again, hold off your vein. You can feel for the vein, make sure you got the fluid wave, make sure your catheter is able to be easily disarticulated, put it back together again so that you have the needle exposed, bevel up. And usually in horses, we will actually try to find our blood first and then we'll try to pass. So we go in at a fairly steep perpendicular angle until we see blood. Once we see blood, we'll take both parts, thread both of them in a little bit. Once that's secured, you can release the jugular vein, thread down the catheter part, leaving the stylet still, and then you can pull out your stylet and hopefully you're still in. These models can also be used just to practice your butterfly catheter techniques. So a lot of times this will be on a recumbent leg, so we can actually lie down our model. Same thing, bevel up, hold the wings. A lot of our patients don't like to hold still. Make sure your cap is off the end, pop it in and release. And then if you don't have blood, you have a chance to redirect until you find it.